The topic is on premarital counseling. And had premarital counseling or not, don't think of marriage without it. To all of you from Delhi Gynecologist Forum, and these are all stalwarts of adolescent health, marriage is a big commitment and most crucial decision in one's life. Through this premarital counseling, the couple is made well aware of the major changes they are going to face after marriage, and then it becomes easy for them to adjust and accept it. Premarital counseling is like a therapy that helps a couple to have a stable and satisfactory married life. It enables the couple to identify and discuss potential areas of conflict, such as money, sex, children, and family issues. Components of premarital counseling are compatibility with partner, responsible sexual behavior, medical aspect, screening for the risk factors, preventive health, chronic diseases, and medication. As for the compatibility with partner is concerned, pre-marriage preparation is based on reality that it is important to strengthen one's relationship and prepare constructively for future challenges and conflicts that everyone will inevitably face at some point in their marriage. The typical marriage involves a marriage of two careers while rearing the children and requires a strong, well-established abilities to communicate, to resolve issues, maintain mutual respect, and set goals. The couple should be made aware that the marriage is based on love and respect for one another, keeping the needs of the other before the needs of the self. The responsible sexual behavior is the basis. Couples often lack a basic knowledge of their reproductive biology. They should be made aware about freedom of sex without the fear of contracting sexuality, transmitted infections, and unwanted pregnancy. They should jointly take decisions pertaining to planning a family. In responsible sexual behavior, marriage can expose a couple to several diseases such as sexually transmitted infections, including HIV and AIDS. Most STI and HIV/AIDS transmission is new in new couples, and their offspring can be avoided by strict adherence to the safe marriage practices through medical counseling and testing of would-be couples. WHO says that responsible sexual behavior is the need. It advocates that the individuals who are entering matrimony should undergo premarital counseling and screening to confirm or infirm the absence of specific diseases, including those transmitted sexually, such as HIV. I wish to tell you that in China and UAE, it is compulsory to have premarital counseling. In our country, it is not made a beginning at all, less than 1%. It's common to get newly wedded couples coming for a medical termination, and they are no less who have been trained in IIT or IM. The couple is usually unaware of the availability and the use of effective contraception. So when it comes from the students from such prestigious institutions, we feel very sad. The couple should be made aware of all the available contraceptive methods, facilitating them to choose a safe and effective methods for future use. The method, if chosen, should be discussed and briefed prior to marriage. And as far as my advocacy for these people is that for the first 6 months, they should use double contraceptive. किसी के माथे में नहीं लिखा कि आपको HIV है. So you should use double contraceptive as we advise to the adolescent girls. The attitude of the couple about contraception is important for accepting it. And here I just wish to tell you, condoms never give you 100% protection from STIs. It is 85%. The medical aspect, the screening for risk, it is desirable that the couple should medically get screened For medical disorders before marriage, some pathological lab offer a package of investigation for the couple called Kundali. It is matching with Patri and the stars, which normally the parents do. And genetic and infectious diseases can be identified. Medical consultation is provided on the odds of transmitting these diseases to the other marriage partner or the children in future, and to give options and alternatives before they are married with the aim of helping them plan for a healthy, sound family. As for the medical aspect is concerned, the dedicated clinics are largely lacking in our country, and there is a felt need for such services, particularly in the public and the private sector. Reproductive health education is not widely disseminated by schools and universities or religious institutions in this particular country. However, I told you about a country like China, UAE, is mandatory by law to undergo premarital counseling, screening, and examination. As for the preventive health is concerned, the preventive aspects which are important include nutrition, especially regarding the prevention of anemia, maintenance of ideal weight, exercise, and vaccination for sexually and placental transmitted diseases such as rubella, hepatitis B, and HPV. Chronic diseases and medications. Whenever there's a presence of chronic medical illness like hypertension, diabetes, heart disease, epilepsy, thyroid disorders, bronchial asthma, collagen vascular diseases, they can negatively impact the future pregnancy, and counseling regarding good control of these conditions is important. The review of medication being taken and if they are potentially teratogenic should be an important consideration during premarital counseling session. Drugs as SACE inhibitors, herbs, statins, valproic acid may be replaced by safer alternatives before planning a pregnancy. Folic acid is called engagement pill, should be advocated in all women at least 3 months before planning a pregnancy. Dedicated premarital clinics involve active involvement of reproductive health specialists, gynecologists, and andrologists to provide counseling and testing. Informed consent is necessary, as well as assurance of confidentiality and privacy is also needed. Premarital programs are most successful when social, religious, ethnic, and cultural factors are all addressed. Now, here is a checklist of comprehensive premarital health package. Coming to the screening is needed where you require a detailed past and a present medical history, the family history, and followed by examination. Screening to detect hemoglobinopathies like sickle cell, thalassemia, if suspected by family history or examination. Screening to identify ABO and RH blood types, because there is a lot of myth going on कि एक blood group के लोगों को शादी नहीं करनी चाहिए, to detect possibility of the blood incompatibility between would-be the couple. That is, we need to tell. Screening to detect infectious diseases like HIV, hepatitis B and C, syphilis are suggested by history and examination. I think this is very much needed. Screening to detect sexually transmitted diseases other than syphilis, HIV, and hepatitis virus, such as gonorrhea and chlamydia, can also be done in case if it is indicated by the history. Screening to identify rubella immunity of females is ideal. Hemoglobin levels to identify the level of anemia. Screening for diabetes, hypertension, because 1/3 of our country people have this as a family history. Screening for obesity and underweight, which is very obvious. Now, if the information and counseling is concerned, it's very important to impart knowledge about reproductive biology and what makes pregnancy. Information about different contraceptive options available for the couple. Counseling regarding the safe sex practices and behavior. counseling regarding ill effects of the substance abuse and alcohol, counseling about optimizing pre-pregnancy weight, healthy lifestyle, nutritive diet, and regular exercises. Information about the effect of chronic diseases, genetic disorders, and teratogenic drugs on a future childbearing and if relevant to the patient. As for the interventions are concerned, here just I wish to tell you that people who take treatment for acne, and if the dermatologist has not informed them that this particular drug can be teratogenic, it can be very harmful. Confirmatory test, if any of the screening test is positive. Vaccination of eligible females for rubella, in case if you find rubella IgG is not there, then it is good to give MMR vaccination. HPV vaccination is ideal to be taken before. Advice is given prior to vaccination to avoid pregnancy for a month in case if you are giving MMR. Vaccination of eligible couple for hepatitis B. Individuals whose partner is hepatitis B positive are given a booster dose of hepatitis B vaccine if they have not been vaccinated before, a full vaccination series if they have not been vaccinated before for hepatitis B. The couples with a family history of hemoglobinopathies or any other genetic diseases are referred to genetic specialists in the region for further evaluation. I'm very strongly of the opinion that two people with thalassemia minor should not marry. Sometime I will make a presentation of cases after cases where people have to really go through a struggle. Referral of person with chronic disorders to respective specialists so as to ensure good control of diseases prior to marriage and pregnancy. Folic acid supplementation before pregnancy is definitely needed. Iron supplementation, iron deficiency anemia. Even if your hemoglobin is 12 gram percent, you need to take iron folic acid supplementation on a weekly basis. And this is my request to all gynecologists that they should make this a part of their practice. These are Government of India guidelines. The treatment of STI is detected during screening. Cessation of smoking, alcohol, and drugs before pregnancy. Optimizing weight in obese patients. Replacement of teratogenic drugs like ACE inhibitors, herbs, lithium, valproic acid, which we take for epilepsy, streptomycin, tetracycline, methotrexate by safer alternatives few months before pregnancy. Solution-focused premarital counseling. Premarital screening often comes too late for a couple to change their opinions about marriage based on the hemoglobin phenotypes, because by this point, they are already committed to their relationship. Further, it is a big taboo for Indian women to reject marriage for these reasons. It may affect her social life, preventing her from ever getting married. Now, solution-focused premarital counseling. The successful approach is solution-focused premarital counseling based on the couple's resources, helping them to develop a shared vision for the marriage. Intervention strategies in those confirmed with positive status for a disease can be developed. So, to conclude, premarital counseling and screening is a very important intervention which mentally and physically prepares the couple entering into matrimony and enables them to share a responsible and stable relationship. Thank you very much.